Hi, this hopefully short video will recap new features in version 930.3247. In terms of recap, first about the deregistering issue. So you can use deregistration. Few caveats here. You will not be able to download patient from CDM to prevention program. I ask for the decision to be reviewed. At the moment, if you saw them, let's say for asthma, you're a young adult for asthma, and then you decide after a while, well, actually it's not that plausible, maybe it was a bit of mistake over diagnosis of a treatment, you want to remove that, and then later they develop hypertension, and you want them to bring them for prevention program for hypertension, you won't be allowed to do that. You should, however, be able to register patient again if they're removed because they lost their medical card, they withdrawn consent, and they want to be enrolled again. That should work. If it doesn't, let support know and let me know, and we'll be looking into that. The message from the registration should be sent both to the PCRS, and then it should remove the patient from the dashboard. They are not too happy also with situation when you saw a patient a couple of times and then you try to deregister them. So it should be used more in accidental registration and or patient moving to nursing home, patient dying, situations like that. The other thing that was improved somehow is the disease finder. So it's still not accurately reflecting what you can register patient for, what condition, but it had been improved tiny bit. I'll show you that now. So what you can do now is you can right click and exclude the patient, and that will give you either amount of months you want to exclude patients for or the date. I can't show exact the window because it's not redacting patients' details. So that's how you can tidy it up. The rationale behind freezing in a way status and not removing is that at some stage your false positive might turn to true positive. And if you just remove them for life from the finder, you would not pick them up when the condition is developed. Now, moving forward, we have much improved encryption of the emails coming out. That will apply only to direct mail. It will not encrypt health mail. Tools, options, internet, and you can select your default way of encryption here. So the option is password protected date of birth. It is in format year, month, date, a day, numbers only, digits only. There's no slashes, no special characters in between, or text message. So the text message will be kind of gold standard, if you will, as it will create a random chaotic password that will be texted to the patient. Versus date of birth, you can always argue that it can be known or guessed by somebody who takes over patient's email, but it's, I guess, more pragmatic solution. So if you create a letter that you want to send out and you use direct mail, you will get this window. It will default to whatever you put in tools, options. You can for each email decide that you want to change that to something different. And when you send it, it will create the encrypted document. So as you can see, when I tried to open it now, it's looking for a password, which is Mary Test date of birth. Now, speaking of passwords, there was a site or two who had troubles with PCRS passwords. So you can access them through Cycle of Care dashboard, probably the easiest. If you click on the green button, it will show you your PCRS credentials for the practice. However, if you had doctors who share the building, share the system for some reason, but they are separate entities as such, you can toggle this button and you can put a specific doctor personal login password for the PCRS, and that should remove issues submitting CDM returns for the situation when the users are separated. Now you might notice here you have a new tab called referral. So it will list any referral that had been sent for the patient through HealthLink, and if you double click on that, that will move you to the transaction when the referral happened, so you can review the details of why you have referred the patient in. Now another improvement, you know, when you import picture using the button here, and if the picture is big, you will be asked if you want to reduce the size on the fly or not. We added the same feature to situation where you would drag and drop picture, because before it was just accepting the size, and now if you drag and drop, you will get exact same question if you want to resize it or not. And probably in most cases you do want to resize it, and it's especially useful if a patient uses their fancy iPhone 2018 and the resolution of those phones is very, very big, and you're just wasting your space in database. Now those of you who cover nursing home hopefully will welcome the option to email the Kardex. So there will be new form for Kardex here, and you can send it both through direct email or through health mail, ideally through health mail, when the nursing home has it, and it will generate the PDF with your prescription, and you can send it away. Small issue that it was reported on a user group: when you put in the GMS number, it will be always moved to capital letters over here, because if you put a small character, the PCRS or the GMS checker was getting upset and it was throwing out errors. So now whatever way you will save it, the HealthOne will know that it should be always a capital letter. And then going back to prescription sending, you will have your tools, options, prescription module, send email to patient when script is sent, and a new box to that is default, meaning that if you select this anytime you send a prescription to the patient, by default it will want to send an email, presuming the email is saved in the database. There was a glitch in this those new templates which say when the medication was last prescribed. Now it has been fixed, so it is accurate. If you want to use my templates and edit them, you're very welcome to. I will attach them and links in the description of the video. If you decide to do templates yourself, if you go to edit template, this is where it lives. So under frequently used fields, repeat prescriptions. So what that will do, that will attract a list of medications with dosing, with amount of tablets, and with last date it had been prescribed in your HealthOne. There is ongoing work with the developers, with Eddie and Philippe, to help to develop automated two-factor authenticator to the HealthOne itself. it's in progress. Hopefully we'll get it soon. In the meantime, use your other two-factor. If you use 2FAS, the transition to in HealthOne Authenticator will be much simpler compared to Microsoft Authenticator. So if you haven't set it up yet, you weren't due yet, and if you're trying to do that or you have to do it, use the 2FAS. That would be my recommendation. That's the end of this video.